on cannabis. It's patent 6603507. And in its abstract, it states unequivocally what the federal government has gleaned from years of research that shows the medical efficaciousness of cannabinoids. So it's almost like I just don't understand, how can our government give itself a patent claiming that it's medically efficacious, stating that to the world, but then turn around at the same time and continue to leave it as a Schedule One drug?
I don't disagree. I think that obviously one of the more interesting areas and aspects there is this weird break between state law and federal law as well, right? So the Schedule One designation, well, there's been obviously significant impact across the board in a few different areas at the federal level. Really, when folks were being charged with possession or sale of a Schedule One substance, it was state to state, and they're being charged under state law, not under federal law. And so what ends up happening is, like in Nevada, for instance, you have really 2 decades worth of folks who are getting charged under the statute. And the worst part about this is when they did it, they did not disaggregate how they were what the actual substance was for the Schedule One designation, right? So Schedule One, for those that don't know, not only includes cannabis. In Nevada, not only included, I should say, cannabis, but also things like heroin. Schedule Two, which is less serious, in Nevada, has methamphetamine, cocaine, and fentanyl. So meth and coke are both listed as Schedule Two substances in Nevada, but cannabis was listed as a Schedule One, which is more severe.
And when it says you're on it, I mean, most people don't know that right now a doctor can prescribe cocaine to people in the hospital for a myriad of illnesses and modalities. I've heard it been prescribed for some asthmatic kind of reactions and some other things, pre-operative reactions. There are several usages, and that pharmaceutical grade cocaine is delivered to hospitals.
Absolutely. And the other thing is, my advocacy in this space has really little to do with trying to get more things on Schedule One. In fact, we'd like to see them removed. There's been success in certain microdosing levels for psychedelic medications and those that have been impacted by PTSD, but we continue to perpetuate this war on drugs. And really, the way that was done was through this weird, nasty back channel scheduling status of cannabis. So really, what happens in Nevada, 2 decades worth of those issues where people are being charged under that statute, which there was other statutes they could have charged folks under, but they continue to charge them for possession and sale of a Schedule One substance. So you try to get data. Well, how many of these were related to cannabis? And